Antibiotics. These are medicines designed to treat bacterial infections. When we feel diseased, we often request our doctor to prescribe an antibiotic. According to research, up to 50% of all antibiotics prescribed were unnecessary or were not taken correctly as prescribed. Here comes the threat of antibiotic resistance, ABR. The problem arises when we overuse antibiotics, or if we use them improperly, or if the infections are not caused by bacteria. Let's see what happens when we take an antibiotic. This lady is suffering from sore throat. Suspecting a bacterial infection, she decides to consult a doctor. She manages to get an antibiotic prescription from her doctor on demand. She takes the medicine. Now the antibiotic is ready for action. But only the bacteria which are susceptible to antibiotic are destroyed. Other than the various susceptible bacteria, there are also some resistant bacteria which survive the attack of antibiotics. Now the war begins. When all the susceptible bacteria are killed, the resistant bacteria get room to grow and divide. The resistant bacteria spreads. And even the people who never had an antibiotic get infected with the resistant bacteria. For a better understanding, let's go through the history of penicillin, the first ever antibiotic used by doctors. Penicillin was first discovered by Alexander Fleming in 1928. The miracle drug was made available to common man in 1940s. Only 1 year later, in 1941, the first person developed penicillin resistance. And by 1950s, this resistance was widespread. The same happened with other antibiotics as well. Tetracycline was used first in 1950 and the resistant strain was reported in 1957. Methicillin was first used in 1960 and the resistant strain was reported in 1962. Gentamicin was first used in 1967 and the resistant strain was reported in 1979. This repeats with every antibiotic discovered. When each of us uses an antibiotic, it becomes less and less effective, not only in us but also for the entire humanity. If we are taking antibiotics when we don't need them, then there won't be any to fight infections when we really need them. Let's take some steps now to save these life-saving antibiotics for the future. Don't take antibiotics unless needed. Never dispense antibiotics without a prescription. Convince patients about the risk when they demand it for minor infections. Educate them that all the infections are not caused by bacteria. To avoid antibiotic resistance, physicians are now trying to prescribe antibiotics more cautiously, using them only when necessary. Never compel your doctor to prescribe an antibiotic. If you are prescribed with an antibiotic, don't hesitate to ask your doctor whether they are sure about the need of an antibiotic. Vaccines. Take vaccines to prevent common infections. Vaccines are directly reducing the need for widespread antibiotic use and thus prevent the emergence of ABR. Don't buy meat raised with antibiotics. Check for these symbols on store-bought meat. If you are prescribed necessarily with an antibiotic, make sure that you complete the course of treatment and never stop in between. Never share antibiotics. Preventing infections is the best way to reduce antibiotic overuse. So, wash your hands, cover your mouth and nose when you sneeze or cough, stay at home when infected, and eat healthy food to boost immunity. Not only bacteria, but viruses, fungi, and parasites also develop resistance, making infections harder to treat. So, we have to fight with antimicrobial resistance, which covers antibacterial resistance. So take care not to misuse or overuse any antimicrobials. Be wise, be safe. Thank you.